So today I am going to discuss about the surgeon console of a robotic surgical system. So this is the example of the Vinci surgeon console. Okay. So it is a part of the Vinci robotic surgical system. So in this video we will discuss about the component of a surgeon console. Sometimes it is written as a SC like surgeon console. So if you see the first one they have mentioned like 3D viewer. So this will be basically a 3D glasses, or they will say like a 3D goggles. So these 3D goggles will help to see the 3D view of a anatomy. Okay, like we have already using the, if you are aware about the robotic surgical system, so always we will use 3D camera for the anatomy view to see the anything inside of the patient body. Okay, so this will help in that, and behind of this one 3D monitor is there. That monitor may be 3D HD 3D, or it may be like 3D 4K. So it depends upon the company to company. Sometimes they will provide HD 3D, and sometimes they will provide 3D 4K. And the second one, if you see, this is called the ergonomics control. So we know when we are going for the 3D movie, so what is our preference? Okay, so our preference is like we will sit back. Why? So we need a proper clarity will be there if we will sit into the back. Okay, and the image quality will also improve. So that's why in all the robotic surgical system the ergonomics control switches are there. So with the help of that, surgeon can be able to adjust the height of this 3D viewer, and then they can be able to adjust the height of this hand rest, and then they can be able to adjust this height of foot panel. Okay, and the third one, if you see, this hole is called armrest, or some company used to say as a hand rest. Okay. So just make it. If you see into the different company will say the different thing. Okay, same thing will say in a different way. So these will help. So surgeon put their hands here, and then they will uh, grab the hand controller, and then they will do the surgery. So in the most of the robotic surgical system they have to do the wrist movement, so that's why they have to put their forearm. So how it is, like surgeon will sit here. Okay, and then this is the right and this is the left of the surgeon. So this is called the right hand controller, and this is called the left hand controller. So the fourth one, it is called the brake. So these two brake will help the surgeon console to be fixed at some places. Okay, and if you see in the fifth one, this whole set is called a this whole set is called a foot switch panel. So in this switch panel there are different switches are there. Some company will call this as a clutch. So why they are used to say clutch, that will I will also explain, and I will explain about the basic functionality of these switches also. Okay, and it is like a total, it contains two and this four, and then this one, this is the seven switches are there. Okay, and then the sixth one, if you see the sixth one, I have already explained about the hand controller. Okay, so in one video I have also uploaded about the hand controller. Just go and watch that shorts. Okay, so this one is right hand controller and this one is left hand controller, and then it comes to the power and emergency stop. So in every console there is these two button you will see. So the red one is called STP. Sometimes they will call it STP, or it is like STP or emergency stop, and this is called the power button. This is called the PV, power button. Okay. And then if you see into this hand rest, there is a one panel is there. So this panel is used for the surgeon profile. Here surgeon can be able to make the profile. It's like surgeon can be able to make their ergonomics according to their height and everything, but where they can say. So this will help, this touch panel will help to make their own profile, and according to their profile, in the next time whenever they will log in with their login ID, so the same ergonomics will be available for them. Okay, they have to just log into their profile and they will get the same ergonomics. Okay, so that is the use of the touch panel. And if it is not mentioned here, but in the robotic surgical the Vinci robotic surgical system, here this is the one head sensor is there. So it is like when surgeon is putting their head inside of these two sensor, then this hand control got activated. Okay, so it is not mentioned in their manual. Okay, so that is the basic component in the every robotic surgical system. So next we will see this SCC. They used to say Surgeon Command Center. I think this is from SSI. So they used to say Mantra. They have Mantra robotic surgical system. This one is the 3.0. Okay. So the complete set is called at Surgeon Command Center, and the second one, in this one there is a little difference in every surgeon console or surgeon command center. They, whatever you want to say, you just learn about it. So this one is a 3D. This one is a 24-inch touch monitor for system control. So with the help of this monitor, we can be able to control. If you see 1 2 3 4 5 is there, so we can be able to, because SS innovation arm card is comes with the modular system. So because of that, they have to control every arm. So this need to be activated from here, so they can be able to control with the system control monitor. And again, this is a 3D monitor, 3D 4K monitor. See, SSI give the 4K monitor. Okay, and then the third one, if you see, this is the head tracking. Okay, this is the head tracking. Whatever the I told you now, in Da Vinci also, they have forget to put the head tracking, so surgeon can be able to put their head. So same things in SSI also. When the surgeon wear the 3D glasses, so they have in the surgeon glasses is there. So in that surgeon glasses, that can be tracked. So surgeon head can be tracked. Okay, so when surgeon move their head outside this head tracking, so the instrument got freeze, it will not work. Okay, so and again the foot pedal is there, and again it's the 2 and 4, and this one is the swap switch. I think SSI having one additional switch on the right also. Okay, so we have to check their manuals. And again, this one is a emergency stop, and this is a power button. Okay, and their ergonomics hand controller is like this one. So here and this place, they will put their this type of hand gripper, they used to say. Okay, and when it comes to the this one, this here one panel is there. So in that panel, the surgeon profile will be made, same thing. And additionally they have given for the mobile holder for the surgeon. Okay, so it is here the mobile holder will be here. And again it comes to the like this is from, I think this is from Meril. Okay, so Meril also have a 3D monitor will be there, this hand controller will be there. This is for the surgeon profile, and here you will see, so this is for e stop, STP. Okay, and power button will be there, this is hand rest. And again, this is a brake. If you see, this is the brake, and then the foot pedal will be there. Okay, so their foot pedal also having the same foot pedal like Da Vinci. Okay, and then this hand rest will be there. These other monitors having a different functionality. I think this monitor is for telesurgery, OT, for the OT view. Okay, so when surgeon is doing the surgery from some other place, nowadays I think telesurgery is very much popular. So this is for that one, and this is for reconfigured. And I think here also one display is there. See, this one is a one display. So Meril having a lot of display. So I will discuss separately about the each surgeon console. Different company having a different surgeon console, and what is the difference between their surgeon console. Okay, so that's it for today, and thanks for watching.